The grievances which will be presented to our employer because they've demanded so. One of the grievances in the ICU, we want a functional ICU with all systems in place with qualified staff, COJT, qualified staff, somebody who can nurse me. Our ICU, I'm told, is not functional. They are missing some items to open that department. So, and also there is no qualified personnel. Qualified actually personnel. Nobody is trained, a well-trained person for that purpose, and that's why they've not opened the department. Issue of PPEs, there is a team which was here from Nairobi last week on quality assurance, and they classified our PPEs, especially masks, as substandards. I have that sample. If somebody wants them, I can provide. We need COVID compensations, especially for our front soldiers, such as the one who has succumbed. Though the results are not yet out, we highly suspect that is COVID. Implementation of COVID circular. Our sister who succumbed yesterday has taught us a lesson. She was an asthmatic patient. This is one of the people ambao wamepaswa kuwa on leave already, but she was working up to her demise. Elderly, other comorbidities, we want that circular be implemented fully. With the provisions of transport such as airlifting of staffs, we lost our staff yesterday because of delayed transport, and that is very, very painful. Aware that some people have not been paid for 8 months, the permanent workers have not been paid for almost 4 months, so we want that be paid immediately. Kama jana tungekuwa na salary, tungekuwa tumechukua ndege ya kupeleka mwenzetu. Cashiers have not been paid. We are aware that COVID allowance was paid discriminately. Some people are not paid, and some were paid even half. HIF cover. Yesterday, our colleague succumbed because she could not even have funds to go to an hospital. A contributor, her payslip shows she's been a contributing member for the last 5 months. Ija that money. Issue of loans is another grievance. Statutory loans, we are deducted in our payslips, but they are never remitted. So all of us who have loans are now CRB rated. We also want issues of promotions and designations addressed immediately. Absorption of cashiers and payment of cashiers. Also placement of cashiers. There are cashiers who don't know even where they are. Some of them are just semi-permanent. They're just confused. Some of them are cleaners. Some of them work there for several years and they are still cleaners. I don't know.
I am also a medical doctor like you. I'm also in the medical fraternity like you. I've been involved also in this COVID, and I know how serious this COVID is. I sympathize with the nurse who died yesterday. She's a hero. She died saving the lives of our people, and she gave her life. So we mourn and pray for her, and we will look and join also her family, and we will look after the affairs as the governor has promised. I want you to continue working and serving your people. I want you to educate our citizens in Isiolo so that they do not have this laissez-faire, attitude to this. I am coming to that. Okay, agreed. Okay, agreed. What we are going to do, you write down then all your concerns.
We have done a lot in this county and more in this hospital. Our hero here, who has just rested, she has been a mentor to all of us, including me. We have worked with her in the rural. She has worked in the SCRI, and actually she has been a hero. Let's all of us start tukijua the ugonjwa huko, tujichunge na tujichunge wenye tunapenda, na tuenda tukieleza watu hii kitu sio ati ni watu wanakula pesa huko juu, kama wakula sisi wanakula au hawakuli, we don't know because we are not there. As let's know what is here attached, na Mungu atatusaidia. Iligonga ukuta such that sikuwa na another way, but me sincerely I thank you guys. You are all heroes. She is the most powerful and the mighty hero here who has already rested.